Okay, Jerry, nice to have you here again in Düsseldorf. This is not your first visit?
No, no.
You were a special patient?
Yes.
So, what is your story?
Basically, Dr. Petsch, I had had a vasectomy about 7 years before I came to you.
Yeah.
I was living in the States at the time, and we just decided not to have any children. So I took it upon myself to have a vasectomy. Then I moved to Europe, and 7 years after the vasectomy, I had met a very lovely woman, and we decided that we wanted to have some children together. We went through several cycles of IVF, which was not successful.
Okay.
And basically, I says, okay, you know, we'll look into like vasectomy reversal. When I had had the original vasectomy, the doctor had said to me, he said that the way I do vasectomies, you will not be able to have this reversed. So I took this as gospel. However, fortunately, I had spoken to my ex-wife, who has a much better memory than me, thank goodness. Okay. And she kindly said, no, this should be possible, you know.
He said cannot be reversed because the length...
Maybe he cauterized it. Okay. You had mentioned that there was a certain length parameter. Okay. And my wife, God bless, my ex-wife, God bless her, said, no, this is within the limits. And so this, I said, it's okay, we'll take this chance. Yeah. And we came to you, I think it was just about 4 years ago. Yeah. We did the procedure. Yeah. The vasectomy reversal. The vasectomy reversal, yeah. And everything was wonderful. You were great. The staff was great.
How long did you stay here in Düsseldorf?
Just 2 or 3 days.
2, 3 nights, I think.
2 nights.
So you came with the plane from Prague?
Came with the plane from Prague.
Had the surgery.
Had the surgery the next day.
And then another night, and then traveled home, wasn't it?
I came when, just 2 nights.
2 nights?
2 nights, that was it.
And did you have any problems after the reversal?
No. No, I mean, it didn't look good, but it was actually less painful than when I did the vasectomy.
Really?
Yeah. It looked like, but it was very nice. Okay. 2 months later, my wife basically got pregnant. Okay. So, and that's, you know, then we had our son.
I remember you wrote some emails with your sperm analysis results from short after the reversal. Correct. And I remember the results showed, what did they tell you?
It was marginal. Basically, okay. It was marginal. They said, you know, there was motility, but it wasn't, you know, it wasn't on the upper end of things.
Okay. And you were kind of worried, is this okay?
We were. In other words, they were basically recommending that, okay, now you have a good sample and we can do a better IVF than before when they did some extraction, which was no fun whatsoever.
So what happened then?
My wife got pregnant. Okay. Before we could do anything else. Okay. You know, then we had our son.
Okay. So your first child was born
in January 2008.
2008.
2008.
So that was about 1 year after the reversal.
Exactly.
Okay.
So I mean, I couldn't, you know, ask for anything better than that.
Okay.
Simply because with my first wife, we had tried for, I don't know, about 7 years, and it was one thing after the next. Unfortunately, so you don't know how it's going to work out.
Okay. But this was not the end of your story, was it?
No, not at all, not at all. My wife says, okay, let's have another child, and I was a little bit hesitant, honestly, but after a while I'm like, okay, why not, we'll do it. And then about 1 month after I had sort of made the decision on my own, she got pregnant. A little bit unexpectedly, but it still happened, and the result was she had a very perfectly normal pregnancy.
Okay. Go ahead.
Perfectly normal pregnancy. At the end of it, we had a very beautiful baby girl. Actually, she's 6 months today, old today.
Okay. So that was your second child? Then?
That was my second child.
Okay.
So, and that's, you know.
And you're coming here today again to
have a vasectomy, and that's our family planning.
Okay.
You know.
So I thank you very much that you give a small interview, and the intention is also to show other people what are realistic chances. What did the people tell you before IVF about reversal?
Well, when I basically where we are, they give you 3 chances. It's paid for, like on our national healthcare system. We have 3 chances, and on the 3rd chance, basically, I says, look, I can't just leave this go, you know, if it's not successful. So I found you on the internet, and we made the appointment. And they actually tried to talk me out of it. They says, you don't need it, it's not going to work, you're throwing your money out of the window. But I felt, I'm just going to go through with this. I'm not going to, you know, leave this. Because, I mean, honestly, frankly, this is the most natural way to do it. Putting hormones in somebody's body does things to people's body chemistry, not always positive. Well, we had some issues with that. And this is the natural way to do it, and I have to thank you, because I don't think it could have result any better, honestly, yeah, objectively speaking.
Certainly not every patient has a successful story like you have. We are lucky to have it that nice way.
No.
But yeah, it gives also some information and hope maybe to other patients.
Exactly. You can't give up. You just have to keep trying and keeping with it until you get this.
You also took some herbal and traditional Chinese medicine.
I did.
To also support your fertility situation.
I did. My wife had been seeing a Chinese doctor just to boost her own immunity system.
Yeah.
And she had given me these Chinese herbs before and after the operation to strengthen it. I'm basically a big skeptic, but if someone's presented to me and it seems to not have any harmful effect, I'm like, fine. And I personally feel that this obviously did have a good effect on it. And throughout the pregnancy, my wife took these Chinese herbs. Okay. It's certainly, the results are there. So I can't say for sure, but if I had to do it all over again, we definitely would have done it the same way.
I sometimes have patients from England or the US who think about, coming to Germany, they don't speak English, or I don't speak German. So how did you feel about coming here?
Not a problem.
As a US person?
Not a problem at all. Matter of fact, you know, I live in Prague, and I says, okay, where would I trust to have this done outside of the States? And it would definitely be Germany.
Yeah.
So that was my first thought. We're right next to Germany, and this is where I did. And I was fortunate enough to, you know, find you right away on the internet, and that was like a no-brainer for me.
So your impression of medical standard here compared to, for example, a US center, what would your...
Easily as good as anything I've seen in the States.
Yeah.
The care was very nice, very professional, clean, the accommodations even were nice. It was easy to get here, find it, so I'm very satisfied.
Did you get any impression of Düsseldorf when you came here?
Oh yeah, it's a great city.
Yeah.
Because I came here, you know, the day before the surgery, so I got to go to the old city, go shopping, and it's a very nice place to...
Some US citizens, they say, where is Düsseldorf? So what is your impression? Airports, the distance to travel to the hospital, city, is it worth traveling here?
Well, I mean, to me it's like, you know, yeah, absolutely. Germany to me is like the States. It's the same high standards, you know, as any place else. You know, it's safety, cleanliness, getting around. English is very widely spoken here. I mean, I speak some German, but I... You
understand some German. You learned German at your high school? In college?
Yeah.
For?
6 months.
6 months, that's it.
But I still remember, yeah.
Okay.
But even without it, I mean, it's no problem getting around. English is very widely spoken.
Okay. And today, do you still feel any symptoms, or do you notice anything from your vasectomy and reversal situation, or?
No, absolutely fine. I mean, it's as if there was there was a little bruising, obviously. Yeah. But very minor discomfort was involved with it. You know, there's really not. You know, it was a great relief that.
Okay.
All right. What else?
So is there anything like a conclusion or a message that you would point out to other persons thinking about what to do after vasectomy and person who wants to have a baby afterwards?
Yeah, I mean, I've been, as we say, I've been through the mill with this. I've been through a lot, you know, many years of trying to do this. I think this, if we had to do it again, we probably would have gone this route first. Should try the vasectomy reversal, do the natural way. The Chinese herbs helped. Again, I'm not a proponent of it. I'm not, you know, apparently it worked, so I would say this is something that wouldn't hurt. But definitely vasectomy reversal, keeping as natural as possible, no hormones. And then, I mean, after that, of course, one has to be prepared for parenthood.
Okay.
And that's a whole other issue that, you know, and if I could say anything, this is just totally off the topic, but dads, to help their wives out as much as possible in the beginning, get as much help as you can. If we've got our in-laws in the house for a few months, no problem whatsoever. Just make sure your wife is comfortable, happy, and you know, you do whatever you can to help her out.
Okay.
That's what I've learned.
Okay.
Sometimes the hard way, but
another question, the prices for the reversal here in Düsseldorf. What was you did some research on the internet, I think, and contacted centers. Was it a fair situation?
I think it was a fair situation. There were places in the States that might have been a little bit less. There was one place that did it for like a third of the price on the local anesthetic, and I'm like, there's no way.
Okay.
I'm not gonna. First of all, the experience that you have was very, very key. I mean, you do so many of them. This is not some place you cut corners. I thought the price was fair for what was received, and I would absolutely no problem with that.
Yeah. Any idea? Anything else that might be interesting for other people?
No, just that. Like I said, it was everything was well prepared, well explained, professionally done. The recovery. There were no scars, for example. I mean, how
about scars?
No scars.
If you look at your scrotum today,
You couldn't tell.
You couldn't tell.
You couldn't tell.
Okay.
Absolutely not.
Healing process took how long? Local healing?
The local, I mean, so that there was nothing that was visible.
Mm-hmm.
I don't know, 2 years. I would say within a week. I mean, I was back to work within, I don't know, like about 3-4 days or something.
3-4 days.
4
you
days.
went back to work.
Yeah, I think. I don't know. My memory is terrible, but it was certainly was not a long recovery period.
Not more than a week.
No, absolutely not. Absolutely not.
Okay.
And what else?
Some patients notice that the test is maybe a bit higher than before. Did you notice any change?
Yeah, I think one might have been a little bit higher than
lifting?
the other one. Yeah, but it wasn't. It was like no issue whatsoever. You know, as far as, you know, sex goes, there was like no problems whatsoever.
This is also a very often question. Yeah, do I have to worry about my sex life?
No, absolutely not. There's no adverse effects. You know, so.
Okay, Jerry.
All right. Thank you, Dr.
very much
Petsch.
for
Thank you
coming
for
here.
everything.